We're conditioned to believe saying yes to every medical test is the responsible way to age. Your doctor schedules a screening, and you show up. But around the time you blow out the candles on your 70th birthday, the math behind preventive care changes. Interventions that used to extend your life start carrying a higher probability of hurting you. This chart maps out what geriatricians call the screening math. At 50, finding a tiny early-stage issue gives you a huge return on investment. You have decades of life ahead to benefit from the treatment. But look at what happens past age 70. The return on investment drops fast into negative territory. Part of the reason is that older bodies naturally develop anomalies. Many of these are so slow-growing that they will never cause a single symptom. You would comfortably live the rest of your life and eventually die with them, not from them. Then there is the cascade effect. A routine screening flags one of those harmless anomalies. That triggers a follow-up test, which demands a biopsy, which leads to surgery, which introduces a complication. At 75, your body handles trauma differently. The risks from anesthesia, hospital-acquired infections, and surgical recovery quickly become far deadlier than the anomaly the initial test was looking for. Let's be extremely clear. If you have a symptom, like chest pain, shortness of breath, or bleeding, get the test. Active symptoms require active medicine. But if you feel perfectly healthy, walking into a clinic just to see if anything is wrong is an invitation for the cascade effect to destroy your quality of life. Take the routine colonoscopy. The United States Preventive Services Task Force advises against it for average-risk adults over 75, and this table explains exactly why. The procedure starts days before you even get to the clinic. The aggressive liquid bowel prep severely dehydrates older patients, frequently causing dangerous drops in potassium and triggering irregular heartbeats. Then comes the scope. In roughly 1 out of every 500 procedures, the instrument perforates the bowel wall. In a 78-year-old, a tear means emergency surgery, weeks in the hospital, a permanent colostomy bag, or worse. The mathematical chance of finding a fast-moving, life-threatening cancer at that age rarely justifies those inputs. A simple, non-invasive annual stool test offers a much safer way to monitor your health. This matrix compares data for aggressive breast and prostate cancer screening over age 70. We're looking at the number of patients needed to treat versus the number harmed by routine mammograms and PSA tests. Up to 40% of these tests flag indolent, slow-growing cancers, but the moment the word cancer hits the chart, the medical machine takes over. Biopsies, radiation, and surgeries follow, frequently leaving patients with permanent incontinence and impotence. You end up suffering through devastating treatments for a disease that was never going to shorten your life in the first place. Another trap is the routine cardiac stress test. Your doctor suggests putting you on a treadmill to see how your heart is doing. Sounds harmless. This chart illustrates the problem. If you take 100 patients with 0 chest pain or shortness of breath, up to 40 get a false positive result. The test says there's a problem when the heart is completely fine. That false alarm forces the doctor's hand. The next step is a cardiac catheterization, threading a tube through your wrist or groin directly into your heart, introducing immediate bleeding and stroke risks. Because you're over 70, the catheterization will almost certainly find age-appropriate partial blockages, and once a blockage is found, a stent usually follows. Massive clinical trials, including the famous ischemia study, have proven that placing stents in stable patients provides 0 extension of life compared to basic medication. You trade the very real risks of surgery, hospital stays, and a lifetime on prescription blood thinners for a procedure that statistically offers 0 longevity benefit over taking a pill and going for a daily walk. Giving a stress test to an older adult with no heart symptoms is a fishing expedition that almost guarantees an invasive, unhelpful intervention. Osteoporosis is a serious threat, and a fall can be devastating. But the standard medical response to a routine bone density scan is flawed. If a DEXA scan shows low density, you get a prescription for bisphosphonates. Take them long enough, and the medication actually increases your risk for atypical femur fractures, the exact breaks they're supposed to prevent. These drugs can also lead to osteonecrosis of the jaw, a painful deterioration of the bone that is incredibly difficult to treat. The data shows that practical interventions, like balance exercises and removing throw rugs, drop your fracture risk more effectively than any pill, with zero side effects. Then there is the most dangerous routine check, the carotid artery ultrasound. This scale shows what happens when screening asymptomatic adults for plaque. Finding a silent 60% blockage will earn you a referral to a vascular surgeon to quote-unquote prevent a stroke. But the surgery itself carries a 2 to 3% risk of causing the stroke you were trying to avoid. The U.S. Preventative Services Task Force specifically advises against this test because the surgical cure objectively harms more patients than the silent plaque ever would. Attempting to surgically clean up silent structural aging often transforms a perfectly healthy senior into a severely disabled one overnight. You can't change how the medical system operates, but you can intercept the cascade effect before it grabs hold of your life. This is the 4 questions protocol. Write these down, keep them in your phone, and bring them to every appointment. First, ask what exactly the test will look for, and second, what the treatment will be if they find something. This forces your doctor to articulate the specific physical risks those treatments pose to an aging body. Third, ask what the actual mathematical risk is of doing nothing at all. Finally, ask if there is a less invasive alternative that provides useful information without the immediate surgical risk. Your doctor might get annoyed. That's okay. Pushing back against routine fishing expeditions is a necessary boundary to protect yourself. If you are bleeding or in pain, you must act. But when you feel perfectly fine, saying no to a routine screening is often the most protective choice you can make for your future health. You have the power to move away from blindly following orders and towards shared decision-making. You have the right to evaluate the math and the right to simply say, "Not right now." True preventive care after 70 is about fiercely protecting your daily quality of life from unnecessary medical harm. Have you or someone you know ever been caught in the cascade effect? Share your story in the comments below. Your experience might help someone else make a better decision.